a very, very good afternoon to everybody who's here. And I think we finished lunch some time back, but we've been eagerly awaiting for this session. And I do hope that you've also been waiting because we are going to have a very power packed session. We have stalwarts from the industry here who do not require an introduction. And so, when we were actually thinking about the topic for this particular panel, and I was also speaking to Manvi earlier, and she had some really nice options and what should we really talk about. And I think there was one thing that I told her that there is so much noise about the diagnostics market, especially the kind of eyeballs that it has had after the pandemic also. I think there are a lot of key things that need to be addressed and discussed. But our agenda, the four of us after this session, would be to give you crystal clarity about a few things and a few messages that we would like to convey to everybody about the diagnostics industry and what is up with it these days. So I think the diagnostics industry right now is the epitome of an example of a VUCA world. The people who are not familiar with what VUCA stands for, it is volatility, uncertainty, complexity, and ambiguity. And trust me, through the pandemic and all that chaos, it is actually a VUCA world that we are living in right now. And today I have with me the esteemed panelists. And quickly, without further ado, I'm going to jump onto my first question to Mr. Bali here. So, Vishal, these days we hear a lot about integrated healthcare. And also in the previous session, Naveenji was discussing about the same and the importance of it. And I think till a few years back, what we actually understood about an integrated healthcare platform was that, okay, you can get your doctor's consult, you can go to your pharmacy, you can get your tests, you can get everything possible from primary till tertiary and quaternary care. But in this integrated setup, firstly, I'd like to understand from you what you actually think is integrated healthcare. Is it like a nice app with a cool UI and UX that helps you navigate through these services, or is it something more? And also, in this world of integration in healthcare, where does the specialty health providers or the specialities of various parts of healthcare actually benefit from this integrated continuum of health? And also, what kind of future do you see for the specialty care in this scenario?
Thank you, Arjun. It's always a pleasure to be on this panel and to be moderated by you. Uh, so let's basically look at where we are as a sector today, right? So India's overall healthcare ecosystem is about $370 odd billion. Healthcare delivery is close to about 120, 130. Then you have diagnostics, which is about anywhere between 8 to 10 billion. It's a large sector today, right? And I think one of the biggest drivers of change that we have seen in the sector over a long period of time, and I've been in this, this sector for now 3 decades, is the power of the consumer. And that seems to be rising more and more with every additional year that we see. So the rise of integrated healthcare, at least worldwide and even over here, was at the center of that was how do we actually provide healthcare services to our consumers end to end. And we just kept on adding verticals into it. It was hospitals first, then let's do diagnostics, then let's do pharmacy. And the latest entrance to all of this is technology or telemedicine and everything else that is associated with technology. Obviously, the other side of integrated health is looking at the consumer as a whole and not in bits and pieces. So, if you're addressing a consumer's well-being and also health, then you look at the whole consumer and not just in specific areas. And that's the real driver, right? Because the consumer wants to be treated probably from a convenience perspective, but more from a healthcare perspective, from a one destination point of view, which also makes us now get into that there is obviously, and I think there will be some financial terms which I may end up using, but there is a lifetime value that we see around consumers and which we see across sectors, which are around us, which are all consumer-centric sectors. And therefore, to sort of engage with this consumer for a very long period of time, and healthcare is one such sector where you want to continue to engage with your consumer over a long period of time. Earlier, technology did not enable that at all because none of us really invested in any of those technologies. Today, your customer relationship management applications allow you to remain engaged with your consumer for a very long period of time. And I think that relevance of integrated health or healthcare offering is now becoming more and more dominant. I've been a big proponent of single specialties, not just because it is a very integral part of AHH, but for a very long period of time, even when I was running the large ecosystems of multi-specialty healthcare delivery, I always felt that there is a great opportunity to personalize more around certain single specialties. Unfortunately, what happened in India for many years, single specialty chains got started and then very quickly morphed themselves into multi-specialty players because it was size, scale, which became the determinant. But I think if you want to stay true to the knitting, single specialty, obviously, again, from a consumer perspective, is one of the most impactful ways that you can deliver healthcare. We've seen it now across oncology. We've seen it in the mother and child space. We're seeing it now in the IVF space. We just invested in Dr. Agarwal's, which is an ophthalmology chain. And I see massive impact that each one of these companies is making to their customer segment group. So I believe that the future rides on the intersection of both the multi-specialty hospital chains and the single specialty hospital chains. But in between all of this, the integrated flow of diagnostics, of other services will continue to be the real future of healthcare.
Well, that's actually, Vishal, very, very well said. And just to sum it up, I feel that patient centricity is the core of integrating any healthcare service. And like you said, I think with the patient at the center and the impact that it has on the patient, I think is crucial for us to understand and also define what an integrated healthcare ecosystem would be. So Dr. Gaur, coming next to you. And so, sir, I've heard this marketing gimmick a lot of times where diagnostics is actually being commoditized, especially in the past few years. And also, I've seen campaigns like date is 9, rate is 9, kidney function for 9 rupees for ladies on World Women's Day. So I think it sounds like a joke, but it's actually upsetting for professionals like us to see how diagnostics is actually being compared like a particular product that you are buying off the shelf, whereas it's like a very, very professionally conducted service that's impacting the patient's health. So what do you have to say about this? And more importantly, for youngsters who are among us, who are going to be future healthcare leaders of our country, what message do you have to reverse this trend?
Well, good afternoon, and thank you, Arjun, for asking a very relevant question, which is actually visible all across everywhere. Let's first, I think I like to say, the debate whether healthcare is getting, commoditized, it's been on for a very long time. Now, let's define, I probably feel the commodity, how do you define a commodity? I think that's something which is important. It's an object, I've read a definition somewhere, which says an object outside us, a thing that by its properties satisfies human wants or some sort of another. That's what is actually a commodity. Now, if you look at this definition, what we need is say food, shelter, tools, they are probably a commodity because that's something we can say that. But when you apply this to the healthcare, probably it doesn't work on that way. No, I think, healthcare should be seen as the policy of commodity organization. What example I give you is if you look into a fire station, in a fire station, you find a lot of commodities. You'll have a fire extinguisher, you have fire engines, you have tools, other things, ladders. But there is a policy out there to use that. I think that is important for us for that matter. Instead of going something, I have this, I have this, I have this, I have this. But what is the outcome actually what's happening? So I think that commoditization is somewhere, there's always a debate. So somebody patient today, we cannot scale, judge the scale of healthcare. You can judge, okay, so many people, so much food is needed, so much shelters are needed. But what about healthcare? I may be well today, suddenly the COVID has come. The scale has gone off track. So, this is something which is you cannot. So if you probably, it's a necessity. It's not a right probably, but it's definitely necessity. It's a need. it cannot be a choice, but it is a need. But yes, I think we need to have a balance. There is a balance, say, for primary health care, universal health care. For that matter, yes, I think it's very important that it is a fundamental right. Everybody gets it. When it comes to the wellness and you feeling of wellness and wow and blah, I think that could be a privilege, could be a commodity, and what you're doing about it. So the universal health coverage, the primary health care, I think, and putting together, I think there has to be a balance into the healthcare. But today, the problem here is simple because unless you commoditize, because because prices, cost is one of the important factors in healthcare. The cost have to be brought down by the market itself. More you use it, the prices are coming down and coming down. Then on the other side, the government is trying to put a brake on many other things because they have to put a quality, insurance, all these things. But they work in isolation. I think we have to work together, whether to bring down the costing, the policy, quality, and not really make it just a commodity. I think that commoditization will happen to some extent, but it's very important to partner, be together, talk to each other, with the policymakers, manufacturers, devices, diagnostic providers like us, service providers, Vishal, investors. I think everybody has to come join in together. And that's probably the message probably I'll feel going forward will help us out.
No, very, very well said, Dr. Gaur. I think it is time, and even post the pandemic, now patients and customers, although I hate calling them customers, but patients do understand what is the value of a correct report. And at the end of the day, it's that report that's going to guide on majority of the decisions that their doctor makes. So it's anything but a commodity. So quickly jumping to you, Sameer, also, I think these days there is absolutely no conversation about diagnostics that is complete without discussing technology. And in your shoes, handling such large firms, I think technology plays a very crucial role right from the time that you hire someone till the time you get back to that entire cycle of servicing the patient. So we are in a world that is being driven by technology and more so in diagnostics. And we're especially hearing a lot about AI in the healthcare sector. And how do you see technology as an enabler in improving access to healthcare as well as affordability? And also, Sameer, do give your comments on how important in healthcare is the human touch along with leveraging technology to give the maximum impact to the health of a patient.
Good afternoon, and thanks, Arjun, for the question. I think if you look at the impact that technology is today making on healthcare, as my co-panelist Vishal, he just mentioned, I think it is all pervasive and it is very clearly here to stay. I think there are enough examples of industries where the technology is essentially coming in, settling down, and then becoming a way of life. And I think that is exactly where healthcare finds itself today. If you look at specifically within the diagnostics space, I think access for sure is improving. There are enough app ecosystems which are today there in the diagnostic space and in the healthcare space at an overall level. If your primary doctor is out of station, that doesn't, and if you are having a condition which requires a consultation, and if your primary doctor, your backup doctor, are, let's say, both of them are out of the station, it doesn't stop you from getting onto an app and doing a consult, so that at least your basic immediate condition is basically addressed. And then once either of them are back, then you basically go back to them and commence the entire journey once again. So I think access for sure is certainly improving, and that's something that we are very clearly saying. Within diagnostics, teleradiology is very clearly an example where this is where it has found its way into a lot of PPP models. So you might be in a tehsil headquarter in one of the states in India, and you would have your radiology X-ray kind of taken, and it would be reviewed by somebody sitting out of another location. So I think this is another example of how the access and the penetration will essentially go up in times to come. when it comes to diagnosis and specifically in terms of oncodiagnostics, that is where the artificial intelligence is basically helping a lot of histopathologists, for example, to basically come at better outcomes, better interpretations, which essentially will be helping the clinical outcomes, over a period of time. Uh, I think the other big case is about 5G. It's knocking at our doors, and there are already enough, examples of use cases, be it robotic surgery or distant surgery, which are already basically being piloted at this particular point in time. And as and when that technology also, kind of stabilizes, becomes more mainstream, that is when you will find a lot of accessibility, going up. Affordability, though, is another dimension. That's when the cost structures would, once all of these technologies come in, that's when the cost structures stabilize, and that's when over a period of time, affordability, kind of goes up. To your second question, Arjun, in terms of the human interface, I think the entire healthcare space is a space where the human interface and the human intervention is, no matter what amount of technology you essentially bring in, ultimately the bedrock of this industry is trust, right? So you, as a patient, you need to trust your lab, you need to trust your doctor, and hence that element, does not go away. I really see technology as only being the bridge between the patient and the doctor or the medical service provider. But the element of trust is something which is very clearly there. And that therefore has a lot of implications on patient centricity. That has a lot of implications on how we train our people, for example. So every provider, it could be a phlebotomist, it could be a medical technician who is essentially processing samples in any of our labs, are put through a series of sensitization programs, because what a technician might see is only a test tube, but there's a human face behind that particular test tube, and that needs to be captured in the thinking, and that's how we endeavor to build processes around the same.
Very, very well said, Sameer. And I think that statement by you deserves a round of applause. It's not a sample; it's a human. And I think all of us come from that school of thought. And I think that's what makes diagnostics so great today. Is that even while leveraging technology, like what Sameer was saying, I think it's more about increasing access by remote reporting and personalized care that we can give to anybody from primary care till oncology, where you can leverage AI and ML and such technologies. So quickly moving on to Vishal. So Vishal, next question is slightly diverting from the topic, but it's actually related to your experience on the global healthcare market. And what kind of different learnings do you feel that the Indian healthcare market, with all its uniqueness that you're familiar with, can take from the global healthcare practices? And also, any other points that would you like to share in your past experience where we can still improve looking at the West?
No, that's a very good question, Arjun. So, I've had the privilege to work in almost about 20 odd countries now. And if you take a look at, you take a look at the Western world, North America, Europe, irrespective of the kind of enterprises, right? Because particularly in the US, you have a lot of not-for-profit institutions, but at the same time, you have private institutions, and you also have teaching institutions. Irrespective of where they come from, the line that actually connects all of them is around tremendous amount of clinical research. And I think that's one area where we have just not made enough attempts in this country. We have a very large population of people. We have a very large healthcare ecosystem now, and it has not been easy to build it. Fundamentally because in the Indian context, healthcare delivery has been powered by private capital, right? So it is not so easy to, because everybody's been in that run to sort of grow and scale. But I think one of the key and most important areas, given the vastness of our population and the vastness of the disease that we see over here, we can do a lot more on the research and innovation side than what we've been able to do till now. So whether you go west or you go east, I think that's the big key determinant, right? I think the other one, which is also very important, is the West learned very early that healthcare needs to learn from other sectors, right? And so therefore, when you look at professionals on the healthcare side, you really see hard-coded professionals. I think we are sort of getting there now in terms of the number of MBA programs and the MHA programs and all the other new education programs that we have to bring out professional managers. But I think that's really the crux now, because the sector needs a tremendous amount of professional input. It is facing opportunities, at the same time it's facing challenges, right? So we've got to sort of absorb both and move forward, and nothing better than good group of professionals trying to push it and lead through it. And last but not the least, I think when we spoke about the entire specialization concept, that has actually come out from the West, right? That people believe that institutions that are powered around single specialties, institutions, or even in the diagnostic world, subspecialization, specialization is the real core, because then you can really excel, right? And you excel in all these areas, and therefore you then have institutions of excellence in those specialties. So I think there is a lot of learning. India is unique in more ways than one. Our market is unique, our structures are unique. Unfortunately, one of the key elements of innovation, particularly in the West, came out from insurance companies, which unfortunately in India, we are still at the cusp of health insurance push in this market, particularly on the private side. Otherwise, that's been one of the biggest enablers of innovation. And we are completely lacking that today. I mean, which health insurance company in this country has actually come out with one product which is massively differentiated and is pushing all of us on the healthcare delivery side to actually do better? Everybody is talking all the time only on one aspect, and that is on pricing. But nobody is talking about actually going out there and innovating around healthcare models. And I think that's, again, something which is lacking in the system today.
No, Vishal, such pearls of wisdom, and that is indeed very pertinent. And I think there's so much for all of us to learn, although the pandemic ushered in its own set of learning. But thank you for that. Very relevant points. So quickly moving on to Dr. Gaur, and actually this is my favorite question of today's panel discussion, sir. And with your years of experience in the IVD industry, I thought you'll be the best to answer this. So now we have a lot of newer entrants and newer labs that have cropped up maybe over the past 18 to 24 months that we are seeing. And every lab comes up with a separate USP. And I think the word quality has been used so extensively that now people obviously have different kind of USPs. Like, I will collect your blood sample in 10 minutes and give you the report in 100 minutes. Or they say we have the biggest celebrity who's a very famous actor or actress. Some people actually say no, that we will match any price that you get, and for 99 or 299 and 999 and things like that. Some people have a very cool app that you can use and get everything from A to Z. But sir, what do you think should actually be a USP of a lab that is just not like a fly-by operator, but it is actually here to sustain and actually what the country needs?
I think, again, this is something happening in day in and out. We're all looking at, I think you walk across Delhi on roads, everywhere you'll find report in 2 hours, report in 3 hours, 199, 299, 399. I really don't know. I think I have seen the journey of diagnostic for a long time. I think it's evolved. But there's something, one of the, the heading of the session for disruption or value creator. I think here, when you have innovation, disruptive innovation has to be for good. Now today, many of the players, which I'm very vocal about it, like they are here for disruption, yes. Pricing may be brought down, but are they giving a value to the customer or a patient? I think probably they're creating a value for themselves. That's happening. So we probably, as a healthcare provider or diagnostic provider, more specific I talk about, we need to give a disruption which is a value to the patient. Outcome-based kind of a thing. No point in having, because it's a question of scaling they talk about. You talk about I've done 10,000 tests, I have 15,000 tests a day, I'm talking about 50 parameters and 200 parameters. I have my reservations on it, number one. That's maybe different because I may be talking different from other people. But scaling may not be better all the time. You need to actually have something which is a value. So probably one parameter is more important than having 15 parameters, and you may have missed that parameter at all because that's expensive, that's a quality, it takes time. But you get carried away by 81 parameters. So I think what are you offering? That's most important part. The component has to be, instead of going what it's like a just pure commodity, what we have discussing about. My message right here is like, what we move forward, yes, disruptive innovations are good, provided they are giving a value to the patient, they're giving value to the customer, and then they're creating a value. Healthcare is a matter of trust. It takes a long time. It's not like we develop today, because in our area, today, it's not a generation like my doctor for lifelong will remain the same. Probably I'm traveling all across, I keep changing my doctors. So that value, that quality, the processes and systems, yes, that is where I think the innovation and disruption should be playing an important role. Number two, I think, customer today, there is an advantage to that also, to disruption. They require entire thing into one go. They require home collection, they require the communication, they want a pre-sample testing advice, post-sensor advice. I think this is we need to integrate together. They're trying to collaborate with these people instead of working all alone here and there. That might not work because but use these people here and there. Secondly, try and build up a skill and infrastructure, which is again cost and value. That is, whatever you're paying, outcome has to be. Anything what you do has to be outcome driven. Thirdly, important is something you should actually be knowing, you should know what is required. It's not like anybody can offer anywhere. You know your geographies, what you want to offer, what are the community needs are. I'll give you a simple example. One of the, I think many of you must have heard, there was a small sales guy. He was exceptionally successful in our country, in India, and he was selling Coke all across. He was the best. So finally, he was sent to a Middle East country. And he went there, he says, after some time, he failed miserably. He says, what happened? He said, no, people don't understand English, so I cannot communicate. So then, he said, okay, why don't you make pictures and do that? So he said, okay, he went again. And he started drawing. The first, he made a can and a man sitting thirsty. Number one. Second can was oh, I have found a can. He's drinking. And the last, I'm very happy. That kind of a picture. So he made first, second, third in a row. After that, he came back. His boss asked, what happened? I miserably failed. Why? Because people in Middle East read from right to left. It was like that. So probably you have to understand that. It is not something you have to understand the need in community. So what I'm trying to say here is, the diagnostic, especially as we move forward, it has to be personalized. You need to give a personal cut to it. You cannot have a generalized kind of a thing. Scaling is good for businesses, but for healthcare, I think it's better to have a better quality, personalized service, which is going to work and will going to deliver. That's what my advice is.
No, sir, I completely agree with you. I think USP should be a QSP of quality, services, and personalized care. So very clear, and I hope the younger leaders of the future have noted that. So Sameer, moving on to the next question that I have for you. And this is on the brink of the pandemic finishing. And I'm sure we are all very proud of the government, how they scaled up the RT-PCR testing also overnight. In a few weeks, we had thousands of labs doing the COVID-19 RT-PCR. But now when I actually look back at the industry, there is so much infrastructure and so much money that was spent on building up these BSL facilities and having that kind of a menu for molecular biology now, especially when the focus was on increasing the RT-PCRs. There's a lot of this vacant infrastructure now. And what would be your guidance, and what would you think would be the best way to utilize this infra that was built up, especially for a country like India, where there are a lot of pressing issues, especially in the communicable diseases space and otherwise as well?
Absolutely, Arjun. And I think there cannot be, you couldn't have picked up a more apt example of a revolution to evolution, right? Because our estimates, kind of suggest that before the pandemic, there were about 30 to 35 molecular testing facilities across the country. And they were largely metro tier 1. Our estimate now is anybody's guess, but it could be most certainly more than 300, right? And very well spread out across all tiers, going right up to tier 4. So yes, there has been a lot of investment that has come in across all the players, in the industry, and you've had a situation wherein, and it was obviously required. There was, I mean, if you rewind 18 months back, there was a time wherein the tremendous pressure, which was essentially there in terms of providing these particular reports on time, necessitated that kind of infrastructure. But today we have a situation wherein you have a lot of facilities which are not being utilized at this particular point in time. The good part that has happened is that at least the facilities have now penetrated into a town tier, which earlier wasn't essentially there. And now I think it's important for the industry to find new use cases for this infrastructure, which is already present. I think a lot of players, including us, have commenced a lot of infectious markers in all these particular facilities. To give you an example, we started something in our PCR facility in Guwahati, wherein we have commenced HPV, HCV kind of tests, which earlier had to travel all the way to Mumbai and had a 3-day TAT. But now today we are basically turning it around on the same day or the next day in that market. And it is much to the delight of the doctors who are essentially associated there. So I think there are enough and more ways to basically utilize this particular infrastructure. It will have its own course. It will take its own course in terms of finding acceptability. But I think the market is there. It's about how we essentially, how the commercials, etc., come in place together for the testing to really take off on that front there.
Definitely, Sameer. I think there was a lot of infra built, and I think we need out-of-the-box ideas, and even things like autoimmune disorders, even HLA typing, even tuberculosis. Again, with the Honorable Prime Minister's vision of eradicating it in the next few years, I think the infra will be extremely helpful. So Vishal, I have my next question to you, and also one thing that I've always wanted to know, and I've been following you since so many years, since your work hard days. So we sometimes hear and talk about value-based leadership. Now, I think value-based leadership is very relevant to today's healthcare industry, especially in India. And usually we also hear about these kind of things where the sales team is supposed to do an upsell, and they go to someone's house and it says that, okay, if you have one package with the patient, but if you convince the spouse or another family member. So at the end of the day, the way that a lot of people and the school of thought where I've been brought up, this is bordering on unethical. And also, I think that value to be instilled in the younger generation from people such as yourselves that actually presses and focuses on the importance of giving what the patient requires, like what Dr. Gaur was saying. I think that's very important. So how would you define value-based leadership in the perspective of the Indian healthcare ecosystem? And also maybe a personal example of your own style of leadership that you've seen to be very effective. I know it's a secret sauce, but I think this is the stage to reveal a few of those secrets.
So let's begin with Arjun more from the context of what's important for all of us as leaders today, right? So we live in a completely uncertain world, and it is only getting more and more complex every day. The global financial markets are not really in a great shape. The war in Ukraine, the entire geopolitical situation of the world, China, India, rest of the world, the entire supply chain getting completely disrupted. Also, what is going to come forward is all currencies of the world are actually depreciating very, very quickly against the dollar. So everything that we all believed was stable for a very long period of time is coming like a perfect storm. And last but not the least, cheap capital, which sort of went behind multiple enterprises around the world, will suddenly dry up. And so there is a ton of companies out there which have been funded exponentially high without really proving unit economics, and they are all going to go now and face the situation of not being able to get their next round of capital in because there is going to be dry powder non-availability for some time. So what does this sort of lead to, right? And from a leadership perspective, what are the three most important areas that become extremely, extremely relevant at this point in time? In my head, the first one is agility, right? We are all going to be leading our businesses or our enterprises or in whatever sphere of work we do with constant change coming and hitting at us every day. If you're not agile enough, if you're not on the ball enough, the chances of you losing rather than winning are far, far higher. So therefore, the ability to actually be very super focused and very sharp of what's really hitting you, and therefore, the second one, which is around adaptability. As I said, healthcare has a lot to learn from other sectors. And one of the bigger areas for healthcare to learn from other sectors is adaptability. We are a sector which has been tremendously hierarchical in its nature, right? We need to break down those boundaries of hierarchy and actually create value in every step of that hierarchy. And, and this goes back to the way that we were all brought up in a generation where in medical colleges, you have the lecturer, the assistant professor, the chairman, and all of that stuff. And therefore, the lines of hierarchy, therefore, went from there into the private sector. So I think that needs to change, and healthcare needs to learn very, very quickly all the good things from the other sectors. And if you see now, many of the companies which are becoming successful in healthcare are all being led by professionals who are not from healthcare, which is very good. And the last but not the most important is accountability. We have to first be accountable to ourselves as individuals, and therefore the value systems that you spoke about. More importantly, there is not one healthcare enterprise in this country today which is either not listed or has not been backed by a venture capital firm or a private equity fund. Accountability, when I say accountability, it means accountability to your shareholders. And accountability of making sure that the enterprises that you run are squeaky clean, right? Because you don't want to be constantly embroiled on the back of that the practices that you adopt are really not the practices that you will grow with. So to me, agility, adaptability, and accountability are the key accountable areas for healthcare professionals in the current state of affairs. Importantly, from my own perspective, as I said, it's been a long journey. And one of the most important aspects with whatever I have done till now has been that as a leader, you grow teams and you grow people, right? You don't grow companies on your own. You grow companies with people. Companies are a direct function of the caliber which is behind them and the talent that is behind them. I'm very fortunate that even today, the companies that I lead today or the companies that I'm part of, some of the people who are there as my CEOs, as my managers, are people who've been with this team for the last 30 years. They all had great opportunities to go and do other things, probably get much, much more rewarded in terms of money terms, but they all chose to be in this knitting of value-based ecosystem, a value-based growth, value-based ability to go and create very impactful healthcare delivery systems. And that's why we are what we are, right? So at AHH what we've been able to do in a couple of years, enterprises take that decades to do. And I think it's all a function of the teams and the talent that we have today. So in my head, my secret mantra is very, very clear. I live and die for my people, and that's the teams that I work with. So that's truly what it is.
Vishal, always inspiring, but this agility, adaptability, and accountability. Hopefully, I'll write a book one day, and if you allow me, I'm going to quote you in that. So quickly, also going on to the last question to Dr. Gaur, and then one quick one to Sameer as well. And so we've seen a lot of specialty diagnostics that have come up in the past. But only a few days back, there was a patient who needed a very high-end functional medicine test. And I had my office find out, and that test was nowhere available in India. And we usually send out samples to Mayo Clinic and such American companies like Genova, etc. And then I finally found that test there. But then the transportation logistics was so high that it was not viable at all. So are there any specialities in the diagnostics space right now where you see that there is further scope of improvement? And sir, if you allow me, we'll keep the questions short. I think I hear that bell ring. My apologies.
And I think, quickly mention what you said. There are a couple of good specialities, I think, which is now probably we should be focusing on, because one is digital pathology. Because, digital pathology, the era has come. We have glass slides which can, you scan it today and which can have an international opinion. Because so subspecialty based opinion, especially in biopsy, that's a new technology which has been adopted in West. I think it's come down to India. I think that's something we all should be looking into it. And this is something 30% of the biopsy, the second opinion, and the errors exist. I think by this we can reduce substantially, number one. Second part is, we have called as genomics, what you talk about, NGS. Now, next generation sequencing was earlier on to oncology, but now it's come to lifestyle and many other things actually. So and it's becoming much, much cheaper. A test which was costing 70,000 rupees now is costing about 12,000 rupees. I think that's something we get it more, and probably apply that to predictive, your primary healthcare, and probably your wellness. I think this is something which algorithms are coming up. You can probably work out much better. Then the artificial intelligence probably as not to replacement, but as a tool to augment the productivity of a pathologist, a scientist. And this is going to place, I think, wonder, because algorithm going to come out of it. Our preventive health checks cannot be like something which is like value of a cholesterol, but there should be health is score. This is the score, and that's what it should. So there are a couple of, in fact, lastly, most important in many things which is coming is we probably corroborate with radiologists. Radiogenetics is coming out, where with the molecular pathology and radiology, probably the imaging can happen, and maybe at some point in time, you go to MRI and probably nothing is required because it's already given you entire genomic sequence. Because this is also happening, the spatial biology mixing up, histogenomics mixing up genomics, and these are the newer areas. I think that's important. Look into it, more important to it, get them here, and this is where I think the right disruption, innovation is needed, and that's going to the future of diagnostic to be, not really what exactly we're looking forward.
No, sir, I completely agree. Lots to learn, and I think the specialty segment also goes in line and also reminds me of something my Dadaji used to say, that a doctor is only a doctor till he's a student. So you have to stay updated and then obviously look at the market and introduce the relevant tests. So quick last question to you, Sameer. And like in your last response also, you're talking about patient centricity. And even Vishal was talking about it. So patient centricity, to understand in very simplified terms, is where each and every process is around the needs of a patient. But in handling such a large scale kind of an operation, Sameer, what do you think are the prerequisites for a firm to have its focus on being patient centric, and any special trainings or any anecdotes that you'd like to share about that?
Sure. So I think if you look at patient centricity today, it has to be patient centricity at scale, right? So if you are having any process, it needs to be done in a fashion that it impacts not just for one patient, but for maybe 100,000 patients. So you need to have that train, that engine, running in a manner so that it all flows in a sequence in that fashion. I think there are two steps to it. I think there is a journey which is outside the individual organization, and then there is a journey inside the organization. So the entire processes which are there, right from phlebotomy all the way to the sample collection to the journey, all of that essentially is outside the organization. Once it enters your lab, then how does it basically go through? What are the series of steps that it essentially flows through? Are those steps synced? Are they really synced very well with your lab information system? I think all of those things really come together, and I think it's very important for us to ensure that there are no breaks in this particular journey, right from the time that the consumer books the appointment till the time that the report is essentially generated. I think there is a series of steps, and in fact, when we did a study, there were almost about 100 plus steps which were there, and out of that, at least there were some 60 odd steps wherein a failure in any one of them would really impact the consumer experience. So how do you correct all of them and deliver at that particular scale? And this also then becomes an important point that anyone who's leading consumer experience today, I wouldn't say only diagnostics, but in a large number of industries, I think has to be extremely tech savvy or has to have an extremely strong tech orientation and a very strong collaboration with the CIO of the company, right? Because I think these two go hand in hand, absolutely. You cannot, we are not in an era today wherein the consumer experience vertical is seen completely as separate from the IT or the digital vertical. I think these two go absolutely hand in hand. And when it comes to training, I think it's as Vishal mentioned, it's about accountability. I think accountability is not just in the boardrooms, but it's also about how do we drive that accountability right down to the front line, and that has to happen through a series of trainings, series of communication, as I've said, not just communication, but probably over communicating a certain point and driving it that level of simplicity in which it is understood by that particular person, because he or she is going to be the person who's finally going to be interacting with the patient there. So I think all of this needs to come together to really drive the patient centricity quotient in any organization.
Very, very well said, Sameer. And I think that is the crux of today, that if pathology has to succeed, it has to be patient-centric. And thank you so much, everybody. It's been extremely enlightening. A lot of learning for me. I hope there was a lot of learning for the audience as well. An extremely privileged and honor to be moderating this panel. Thank you, ET, so much for the opportunity.